Welcome to the SIBO Doctor podcast with Dr. Nirala Jacobi, a US-trained naturopathic physician and medical director of the SIBO Doctor, an online education resource for practitioners. This podcast is intended for SIBO treating practitioners and aims to help educate how we may best serve our SIBO patients. Medical experts join us to discuss functional digestive disorders, clinical practice and research as it relates to SIBO and associated conditions. Head over to thesibodoctor.com where you can learn everything about SIBO from the basics to advanced treatments. You can also join in the conversation on the SIBO Doctor Practitioner Forum Facebook group. If you're a patient, please note this information is not intended to diagnose or treat medical conditions. Please ask your doctor before initiating any new treatments. We welcome you to head over to the SIBO Lifestyle Facebook group, where we post frequent tips and videos to help you on the road to gut health recovery. And now, over to Dr. Jacobi and the SIBO Doctor podcast.
Welcome, SIBO Doctor practitioners. It's Dr. Nirala Jacobi here with the very last podcast for the year. Wow, it's been a really busy year for the SIBO Doctor. We've launched all sorts of courses and created handouts and quizzes and have a lot more in store for you in 2019. But I thought we'd just take the last podcast of the year and look back over the year and also see what we've learned in the field of SIBO in terms of research and development, and then kind of look towards the future as to what 2019 may bring us. So the big news of the year, of course, was the hydrogen sulfide testing that might become available soon. And this was brought up by Dr. Pimentel at the different SIBO symposiums and DDW, which is a yearly week-long session where all the thousands of gastroenterologists kind of congregate. And so he's made this announcement that a study has been made about hydrogen sulfide with diarrhea-dominant SIBO, and that Cedars-Sinai group has developed the testing for it. So I think that we can't really expect a commercial release for this test. Probably my guesstimate would be another year or two. So it's a very, very frequent question that we get at the SIBO Doctor. But as of now, we can't really test it yet in the small intestine. We have been relying on flatlining breath tests in terms of hydrogen and methane in a lactulose breath test for a while, and that still goes. And then on a stool test, which does not really give you an idea about small intestine, but you can assess for large intestinal hydrogen sulfide production with using different types of stool tests that utilize the PCR or DNA analysis of the microbiome. Actually, Dr. Greg Nye, we released a podcast with him earlier this year, podcast number 20, where he talked about the endogenous production of hydrogen sulfide and its importance. And I actually gave a presentation in New Orleans at this Integrative SIBO Symposium and talked more about the exogenous production by particular sulfur-reducing bacteria. And that masterclass is actually available on the SIBO Doctor, the hydrogen sulfide masterclass. And you can check out if you would like to know more. There is definitely seems to be hydrogen sulfide in general. I often describe as sort of having a Goldilocks concentration where too little is not good, and too high obviously is also not good. But hydrogen sulfide in general is also produced in the human body, so it's not a villain that we must completely eradicate. But some people tend to have a worse time with hydrogen sulfide than others. And I want to just pause here and say that generally we think of it as two really separate conditions if you have hydrogen sulfide in the small intestine versus the large intestine. The large intestine clears hydrogen sulfide about 20 times faster than and more efficiently than the small intestine. So the large intestine really has the capacity to deal with hydrogen sulfide. But here again, in high concentrations, can also cause damage and has been associated with ulcerative colitis, among other issues. But in small concentrations, it tends to have an anti-inflammatory effect. So whereas in the small intestine, it's really not supposed to be there. And high amounts of hydrogen sulfide has been definitely more associated with diarrhea, as was discussed with or by Dr. Pimentel in these presentations that he gave. So that's a real interesting newcomer in the field of SIBO, and their various treatment protocols. We don't have a huge amount of herbal antimicrobials that we know of. And part of this is because hydrogen sulfide producers are really resistant to a lot of antibiotics. And it's known that people that have had a lot of antibiotics in their past are more prone to hydrogen sulfide overgrowth because of this very issue, that they're very that these hydrogen sulfide producers like desulfovibrio and bilophila are very resistant to antibiotic treatment. So it makes sense that people that have had a lot of antibiotics basically wiped out all the normal microbial balance, and that there is more of an issue with potential overgrowth with these sulfur-reducing bacteria. So yeah, we need more research and anecdotal evidence as well from people and practitioners having treated hydrogen sulfide dominant SIBO or LIBO. We know about bismuth, we know about oil of oregano. Berberine I find is a little bit iffy. It doesn't usually get the job totally done. So we really do need to know more about different plants and botanicals rather, as to what their effect might be on hydrogen sulfide production and these particular organisms. So then we moved, as the year progressed, we also looked at the elemental diet a little bit closer, and I had a fantastic interview with Dr. Leila Altman discussing in detail the pitfalls and the hallelujah moments that she experiences with her patients on the elemental diet. There is a homemade version available that's still on Dr. Seebecker's website at siboinfo.com. And it's really, I've used it a lot more this year it's really dramatic, the gas reduction that we see with the elemental diet. So if you haven't tried it in your practice, I do encourage you to have a look at how you can implement this as a recommendation in lieu of herbal antimicrobials or antibiotics. One thing I forgot to mention about the hydrogen sulfide topic is that we do have a free hydrogen sulfide diet on the SIBO Doctor. It's a free download. And this being the last podcast before Christmas, I will sort of talk about all the freebies that you can access easily on the SIBO Doctor website. But the hydrogen sulfide diet is one. I find that it can be easily added on to the biphasic diet as in terms of reducing the sulfur-containing foods, namely garlic and onions. We already know about those, but also cruciferous vegetables like broccoli, cauliflower. Cauliflower anyways isn't on the biphasic diet, but broccoli is. And also kale. Kale tends to be high in sulfur. And so foods, as well as eggs, of course. So it gets a little sparse on the biphasic diet, but there are some tips how you can incorporate that a little easier. One of the highlights for me of the year was to have Dr. Stephen Sandberg Lewis, who is a professor of gastroenterology at National University of Natural Medicine in Portland, Oregon. He's been in practice for 40 years, and he's been teaching gastroenterology at that college for a long time. He came over to Australia, and we had a weekend where he showed us or taught us the skills of a functional physical exam of the digestive tract, and it was just so phenomenal. Already I'm seeing amazing feedback from practitioners and from patients that I've seen since then. So that is the functional gastrointestinal practicum that we will have available on the SIBO Doctor in the new year, probably in January. So look for that. You can learn how to do the hiatal hernia maneuver. You can learn how to do the ileocecal valve maneuver. You can learn how to do even emotional freedom technique and a lot of Chapman and Bennett reflexes. And it was just such a fabulous weekend where I think he's such an icon. He wrote a book called Functional Gastroenterology. And it's so invaluable to have these tools in practice where you can actually physically check to see what to also prioritize and where the actual issue is. So it's such an honor to have had him because he's been teaching this for so long. And I think people are going to find it incredibly, incredibly useful. We also had his wife, Kayla Sandberg-Lewis, on the SIBO Doctor podcast, and she talked about traumatic brain injury and SIBO. And this is a whole new frontier that I personally find so absolutely fascinating because I think that it's a part of the symptom picture or the history, rather, that patients present with that we don't often give a whole lot of attention to in terms of what's happened to them years before. Of course, sometimes it's relevant, but we don't often ask about if they ever lost consciousness or had massive car accidents where they lost consciousness. And so this has really made its way more on my patient questionnaire in terms of looking for potential traumatic brain injury that does interfere with the autonomic nervous system and causes a level of either dysautonomia or motility disorders in particular. So that's a really useful podcast. It was probably the toughest in terms of if you listen to podcasts a lot, sometimes the technology or the sounds of the recording is dictated by whatever happens in the Pacific that day, being in Australia. So I apologize, but it is still extremely good information that you can listen to. Also, I did a 2018 SIBO update webinar that I do every year where we talk about the developments in the field of SIBO. And I talked about hydrogen sulfide, as I've mentioned, but also really what's been fleshed out a little bit more, for me in particular, has been the role of dysautonomia or malfunctioning autonomic nervous system in the role of the development of SIBO and how this can be associated with so many other conditions that have dysautonomia as a real feature, like postural orthostatic tachycardia syndrome or POTS, mast cell activation syndrome or MCAS, and Ehlers-Danlos syndrome or EDS. And that's a hypermobility issue of the connective tissue. So I really looked into this a lot deeper after this has been presented by a few presenters at the different symposiums. And I do think this is a major factor in many people with chronic illness, especially mast cell activation syndrome. I see more and more in my practice as a contributing factor. And this is really on the spectrum of histamine intolerance, where histamine intolerance is pretty mild compared to a full-fledged mast cell activation syndrome that is a very trigger-happy mast cell and spills histamine and other cytokines. Actually, turns out that histamine also releases heparin as one of its mediators, and so easy bruising is something I look for much more in my super reactive patients. So the 2018 update webinar is also available. Another course we've released, finally I have made it available earlier this year, is called the Biphasic treatment course, where we talk about the various treatment options for SIBO, but really it's way beyond that. We go into all the different herbs, all the different food intolerances that you can encounter very, very often, such as histamine intolerance, salicylates, oxalates, etc. So we talk about that in that course, and it's a real good all-arounder for those of you listening as practitioners who may have just started and don't really know beyond the basics in terms of treatment as to what else you can encounter. So I do very much recommend that one. A new handout besides the original biphasic biphasic diet that's been out now for a few years and has had thousands and thousands of downloads by practitioners and patients as a treatment tool. So the biphasic diet is a treatment, or it's an adjunct to the antimicrobials, but it's a diet that is divided into 2 phases, and it really organizes your treatment strategy towards SIBO. And Heidi Turner and I, Heidi, who's an exceptional dietitian and nutritionist in Seattle, we've created the histamine biphasic diet, or the SIBO histamine biphasic diet, which is a free download if you're suspecting your patient has histamine intolerance or potentially mast cell activation syndrome. And the symptoms of histamine intolerance are, because histamine, you can have 5 different histamine receptors in different compartments of the body. That's the central nervous system and the digestive tract, the immune system, etc. And so the symptoms of histamine intolerance can be digestive in terms of gas, bloating, cramping, diarrhea, or constipation, so very similar to SIBO. But also we often see a sort of an allergic component where either hay fever type symptoms or headaches or cramping or menstrual issues. Insomnia is very common. So it is one of those elusive conditions that often accompanies SIBO, actually. So you can have a look at the new SIBO histamine biphasic diet, which is also a free download on the SIBO Doctor. And all the links are going to be in the show notes for you. One really free handout that I'm super proud of that we've created for patients and for practitioners alike, also a free download, is called What Caused My SIBO? And I've been busy this year with really making the whole area of underlying causes to SIBO a much more digestible field for practitioners in terms of how to really understand what category of underlying cause the patient really has. And so I talk about that in the biphasic course, but basically, and also I've done a few Facebook Lives, so you might want to go to the SIBO Doctor Facebook group and have a look at that, where basically those are 4 categories of underlying causes. The main bulky category, of course, is motility disorders, where the upper digestive tract has sort of limited or impaired motility for a variety of reasons. And those of us who've been in the SIBO field for a long time, we know about the migrating motor complex, which is part of the enteric nervous system in the upper gut that really clears out bacteria that remain in the upper gut. Every 90 minutes on an empty stomach, your small intestine is supposed to be swept out. And so these conditions that are underlying causes basically have SIBO as another condition that is caused by the underlying cause. So SIBO is not the end result of that. And this is really important to remember, that SIBO is a consequence of something. So in this motility category, or impaired motility, is of course post-infectious IBS, where you've had a case of gastroenteritis or food poisoning, and your body launches an autoimmune response to the toxins released by the food poisoning bacteria that then results in damage to the migrating motor complex. But in this category are also the dysautonomic conditions I've just mentioned of POTS, MCAS, Ehlers-Danlos loss, or hypomobility in general, but also hypothyroidism, traumatic brain injury, mold toxicity, stealth infections. And so it's an ever-increasing list of conditions that can cause dysautonomia, and that's why we see SIBO so often be associated with that. And in the new year, when I'm going to focus on developing and releasing the certification course for practitioners, we will go into those conditions a lot more and talk about what you can do for your patients to really truly cure SIBO for them and not just treat the symptoms. The other 3 categories of underlying causes of SIBO are impaired digestion. So anything that can cause hypochlorhydria, like chronic gastritis or autoimmune gastritis or simple hypochlorhydria, but also exocrine pancreatic insufficiency, so an imbalance or a deficiency of pancreatic enzymes, and then bile issues or biliary issues where bile is not either adequately produced or it's not flowing from the bile duct efficiently. So all those three digestive juices, the hydrochloric acid, bile, and pancreatic enzymes, are our natural defenses against SIBO. So it's pretty obvious as to why you would develop SIBO if anything is wrong in those categories. Then we also have category 3, which is medications that can interfere with the general motility of the digestive tract, and that is things like opiates and certain narcotics and those types of things. And then lastly, category 4 is some impaired outflow where the food or the digestive products of digestion are not moving along because of a kink in the garden hose, is what I usually describe it as, where basically you've had some sort of surgery in the abdomen, whether that's a removal of the gallbladder or a hysterectomy or a cesarean birth or even a laparoscopy. So sometimes very simple procedures where it involves going into the abdomen that can trigger adhesion or scar tissue formation that then just changes the anatomical flow through the small intestine, kind of like a scar tissue that attaches and creates a kink in the garden hose. So, and if outflow is impaired, you can have bacterial fermentation and non-clearance up above. So those are the 4 categories of underlying causes of SIBO. And I'm sure we'll see more added to that in the future. But that handout, What Caused My SIBO, to help you find out what category you're actually in or to help your practitioner, is also available on the SIBO Doctor. Then we had a very, very popular course be released, and I've talked to Dr. Jason Horlak a couple times on the podcast about microbiome restoration. And a really fascinating, super hot topic right now, where we're starting to understand a lot more about how to properly actually regrow the rainforest. And there's still a lot we don't know, but we know a lot more than we did a few years ago. So have a look at those podcasts about probiotics, and I think we called it microbiome restoration is the name of the course. But the episode 26 is all about the microbiome. Really fascinating stuff as to how to regrow native species. You can't just use probiotics and expect them to grow like seeds that you've planted. It just doesn't work that way. So as practitioners, we really need to stay abreast with this developing research into the microbiome, which is really absolutely a fascinating topic. I think besides the autonomic nervous system, it's probably my favorite topic, is the microbiome. We had Dr. Megan Taylor talk about SIBO in kids, which is always very interesting. That was episode 30. And Dr. Ginger Nash joined us for a talk about lymphatics, and often an overlooked system as well for those who are quite ill and or non-responders and people that really need a lot more support with detoxification. And she had some brilliant ideas as to how to increase lymphatic flow. And the most recent was one podcast, number 32, actually, was Dr. Satish Rao, who many of you may remember. He published a study about SIFO, or small intestine fungal overgrowth, being very often present alongside SIBO. But in this episode, I talked to him about the brain fog. He's come up with a new study, and D-lactic acidosis, which is a condition where lactic acid is built up and not cleared. And he had an interesting study about brain fog, so check that one out as well. So yeah, that was the year in review, more or less. And want to just remind you that we have all these new courses available on the SIBO Doctor. Also, all these new free downloads from the original biphasic diet, the histamine biphasic diet, the hydrogen sulfide diet, and what caused my SIBO handout. And we have a ton of handouts that accompany our courses, like Dr. Jacobi's dispensary guide that comes along with the Biphasic course. So we really aim to offer a very comprehensive approach to treating SIBO and give you a wonderful education about the topic, CPE approved. So really just wanted to share with you that a lot of work has gone into that. And what's coming up in 2019 is the SIBO certification course. We're also in talks about having an inflammatory bowel disease, the natural treatment of inflammatory bowel disease, be also offered, a course on that. The Dr. Steven Sandberg Lewis functional digestive physical exam will be available in January. And I hope to see you all in the new year. Thank you so much for supporting us and for listening and for treating your patients. A lot of desperate people that have never heard about SIBO have just been diagnosed, and it is wonderful that you take time out of your busy schedule to get educated on this very important topic. Also, it would be wonderful if you could leave a review for us in iTunes so that others can hear us. You know that we don't have ads in our program, so it's great if we can increase our listenership organically, and that's usually done with reviews by our listeners. So I wish you truly a wonderful beginning to 2019, and I'm excited about what we're going to be releasing, and I hope to see you also at the SIBO Symposium or Integrative SIBO Conference in Seattle. And also join us on the Facebook groups that we've created, SIBO Lifestyle for patients that are listening, and the SIBO Doctor Practitioner Forum, which is a great way to run cases by your peers or have your questions answered. So join us on Facebook, and we're also now on Instagram. So thank you so much, and we'll see you in the new year. All the best to you.
Thank you for listening to the SIBO Doctor podcast. We hope you found the information in this episode useful in the treatment of your SIBO patients. Thanks to our sponsors, SIBOtest.com, a breath testing service with easy online ordering, and Quintron, maker of outstanding breath testing equipment. Tune in again for another episode of the SIBO Doctor podcast. Thanks again for listening.